Hello again, my name is Madison Holt, and I'm an occupational therapy assistant student at Jackson State Community College, and today we are going to be practicing hand range of motion. Is that okay? Okay. First, we are going to be working on MCP Flexion, and to begin, I'm going to need you in a neutral position like this. And for MCP Flexion, you're just going to bring your fingers in and make a fist like that. Perfect. Go ahead and bring it back out. Now to measure this, I'm going to place the fulcrum on your MCP joint. I'm going to place the proximal arm in line with the first metacarpal, and the distal arm is going to be in line with the proximal phalanx. I'm going to stabilize the metacarpal to ensure there is no wrist motion to occur. And go ahead and flex your hand. Normal is 0 to 90, and you are 0 to 81. If I were to perform the manual muscle test, I would stabilize the lumbricals, the flexor digitorum superficialis, and the flexor digitorum profundus. Next, we are going to be working on MCP Abduction, which is, you'll be having your hand placed on the table like this, palm face down, and you're going to take your index finger and bring it away. Can you do that? Awesome. Go ahead and bring it back up. In. And I'm going to measure this by placing the fulcrum on the MCP joint. The proximal arm is going to be in line with the metacarpal, and the distal arm is going to be in line with the proximal phalanx. I'm going to stabilize the metacarpal to ensure there's no wrist movement. And when you're ready, go ahead and bring your finger away. Perfect. Normal is 0 to 20, and you are 0 to 20. If I were to perform the manual muscle test, I would palpate the dorsal interossi and the abductor digit minima. Next, we are going to go back to the finger goniometer and have your arm back in this neutral position like this. Now for PIP Flexion, we are going to be working mainly with the index finger, and you're just going to bring your index finger in like that. All right, go ahead and bring it back out. Perfect. Now to measure this, I'm going to place the fulcrum on the PIP joint. The proximal arm is going to be in line with the proximal phalanx, and the distal arm is going to be in line with the middle phalanx. I'm going to stabilize the proximal phalanx to ensure that the MCP joint does not move. So whenever you're ready, go ahead and flex your PIP joint. Perfect. Normal is 0 to 100. You are 0 to 85. If I were to perform a manual muscle test, I would palpate the flexor digitorum superficialis and the flexor digitorum profundus. Next, we're going to do DIP Flexion, which have your hand back in that neutral position. And this one's similar to the PIP Flexion, and you're just going to be bringing your DIP joint in like that. Just like that. Can you try and do it? Perfect. Okay, go ahead and bring it back out. I'm going to place my fulcrum on your DIP joint. My proximal arm is going to be in line with the middle and proximal phalanx, and my distal arm is going to be in line with the distal phalanx. I'm going to stabilize the middle phalanx to ensure that the PIP joint does not move. And whenever you're ready, go ahead and flex your DIP joint. There we go. Normal is 0 to 90, and you have 0 to 97. If I were to perform a manual muscle test, I would palpate the flexor digitorum profundus. Lastly, we are going to be working with your thumb. So go ahead and place your arm in supine. And this is thumb MP Flexion, and you're going to take your thumb and flex it across your hand like that. Can you do that? Perfect. Go ahead and bring it back out. Now to measure this, I'm going to place the fulcrum on your MCP joint and your thumb. I'm going to, the proximal arm is going to be in line with the metacarpal, And my distal arm is going to be in line with the proximal phalanx. I'm going to stabilize the metacarpal to ensure there is no wrist motion. Whenever you're ready, go ahead and flex your thumb. Perfect. Normal is 0 to 50, and you are 0 to 70. If I were to perform a manual muscle test, I would palpate the flexor pollicis brevis.